Hello and welcome. Today we'll be exploring a rare but serious condition affecting the urinary system, ureteral atresia. Ureteral atresia occurs during fetal development. The exact cause remains largely unknown, but it's considered a congenital condition, meaning it's present at birth. Genetic factors, environmental influences during pregnancy, or a combination of both are suspected to play a role in disrupting normal ureteral formation. Research is ongoing to pinpoint specific genes or environmental exposures linked to this condition. Ureteral atresia involves the complete blockage or absence of a portion, or even the entirety of the ureter, the tube that carries urine from the kidney to the bladder. This obstruction prevents urine from flowing normally. As a result, urine backs up into the kidney, a condition known as hydronephrosis. Prolonged hydronephrosis can damage the kidney, leading to impaired renal function and potentially kidney failure if left untreated. Ureteral atresia is a relatively rare condition. Accurate epidemiological data is limited due to its rarity and potential for prenatal diagnosis. However, estimates suggest that it occurs in a small percentage of births, making it a significant concern for pediatric urologists and nephrologists. The signs and symptoms of ureteral atresia can vary depending on the severity of the blockage and the extent of kidney damage. In severe cases, it may be detected prenatally during routine ultrasound scans as hydronephrosis. After birth, infants may present with abdominal distension, urinary tract infections, failure to thrive, lethargy, or even complete absence of urine output. In some milder cases, the condition might not be apparent until later in childhood, when symptoms like recurrent UTIs or hypertension develop. Diagnosis typically begins with prenatal ultrasound, which may reveal hydronephrosis. After birth, further investigations are required. These may include voiding cystoarthrogram (VCUG) to evaluate the bladder and urethra, renal ultrasound to visualize the kidneys and ureters, G3 scan or DTPA scan to assess kidney function and drainage, and possibly a retrograde pyelogram, a procedure where dye is injected into the ureter to visualize it more clearly. These tests help confirm the diagnosis and determine the extent and location of the atresia. Ureteral atresia doesn't typically have distinct classifications or types, but rather varies in terms of its location and extent. It can affect a small segment of the ureter, the entire ureter, or be associated with other congenital anomalies. The severity of the obstruction and the presence of associated kidney damage further influence the clinical presentation and management strategy. The primary goal of treatment is to relieve the obstruction and preserve kidney function. The specific approach depends on the location and extent of the atresia. Surgical intervention is almost always necessary. Options include ureteral reimplantation, where the ureter is disconnected and reconnected to the bladder in a new location, ureterostomy, where the healthy ends of the ureter are joined together, or, in severe cases where the kidney is severely damaged, nephrectomy, the removal of the affected kidney. Management also includes preventing urinary tract infections with prophylactic antibiotics and monitoring kidney function regularly. Since ureteral atresia is a congenital condition, there's no known way to definitively prevent it. However, optimizing prenatal care, ensuring adequate nutrition during pregnancy, and avoiding exposure to known teratogens, substances that can cause birth defects, may help reduce the risk of congenital anomalies in general. The prognosis for ureteral atresia depends on the severity of the condition, the promptness of diagnosis and treatment, and the extent of kidney damage. Early detection and surgical intervention can significantly improve outcomes and preserve kidney function. However, even with successful treatment, long-term monitoring is necessary to detect and manage any potential complications, such as recurrent UTIs, hypertension, or impaired kidney function. Research continues to focus on improving surgical techniques, understanding the genetic basis of ureteral atresia, and developing strategies for earlier detection and intervention to optimize long-term outcomes for affected individuals.